Wondering if medication is the only option for your child? Discover when non medication approaches can actually transform your child's mood, attention, and behavior. This is part of our ongoing discussion about non medication approaches. And we can't talk about all the ways to regulate the nervous system unless we talk about when should you actually consider non-medication approaches. Well, first of all, as I always say, medication should never be the first line of defense in dealing with an issue in a developing brain, right? Kids' brains are developing until they're 28. Actually, the frontal lobes don't fully form until then. And why would medication be our first option? It's like telling us that there's, only one type of shoe, right? That we believe that every single problem is neurotransmitter. And the science tells us something completely different. There are many reasons why a nervous system dysregulates, but until you regulate the nervous system, learning, healing, attention, action isn't going to occur in the way it's supposed to or at all. When we, go to medication, right, it just doesn't address root causes. And what I love about non-medication approaches, not all of them, but most of them, is that it really tries to get to what's at the bottom, what really is driving that behavior, right? These are types of therapies that focus on nervous system regulation, right? And when we regulate the nervous system, we improve behavior, we improve health, and we are addressing underlying causes, right? So let's jump into when we should consider non medication approaches over traditional medication. As I talked about, if you haven't tried anything else, why are you starting with medication? That's just silly, right? There are other things that science shows us the way, okay? And every nervous system, whether you're neurodivergent, neurotypical, whatever's going on, right, deserves regulation. We need it for physical and mental health. There are many ways to do it. Let's follow the science, right? So if you haven't tried anything else yet, you really should start with the least restrictive thing, which are non-medication approaches, right? And we're going to talk about different factors, right? If you are a parent who's concerned about medication side effects, don't start there. From, psychotherapy to PEMF, magnesium, you're learning about all these different ways, right? If you haven't addressed behaviors, family system issues, or parent dysregulation, guess what? You need to start there. You can't have a completely dysregulated family and then focus on the one kid. There's a whole section in my book called Angry See, Angry Do about an angry family that I worked with who just kept blaming their kids. And they were so angry that it was tough for even me as a trained professional to talk to them. And they literally said, it doesn't make a difference. And I was like, oh, it does. And sadly, they chose to hold on to their anger, and it's just going to keep coming back. That's an extreme example. There are lots of things that kind of creep up, and we need to address them behaviorally. It does not mean you're a bad parent. Hopefully you're not. But what it might mean is that you're faced with an obstacle, you just don't know what to do, right? And that's why a lot of times people, seek support from me. If you're looking for help, go to drroseann.com/help. It's going to take you to that solution matcher. It's going to guide you to the right solution and give you good info. Info is only as good as if you take action with it, right? What other times could it be that you should be considering non-medication approaches, right? You are already holistic and it aligns with your family values. Why would you go outside of that? Don't get caught up in this fear mongering that people do to you, or people say stupid things like, why wouldn't you medicate your kid? I mean, people say stupid things to me, and this is the last time in my personal life that I don't want to talk to you again. So you don't fall into that. What do they know? They don't know anything. They watch the Housewives of Jersey, right? Another time is when certainly of mild to moderate symptoms and they are disruptive but not debilitating. Like, this isn't a crisis. Nobody's in danger, right? Start with things that really address the core issues, right? It is much better. Now, there's a belief, this magical thinking that there's something that's a quick fix. I don't know what that is. I certainly use a lot of tools that accelerate it. magnesium con PMF, neurofeedback, man, do they work quick when you pair it with new learning. Okay. Because you got to actually do something different, right? You can't just say, I'm going to fit this square peg in this round hole over and over and over again. But we do that in mental health. I'm going to try this medication 8 times, even though 4 times that kid had a psychotic break. True story with somebody I work with, and I thought to myself, why do you keep doing that? I mean, 4 psychotic breaks, clearly not okay. Another reason to try non medication approaches is you haven't been responsive to traditional approaches, which is pretty much 80% of the cases that get to me is they have not been responsive. And you already know I work with very serious cases. These are not light cases. These are very complex cases. And I get much further with neurofeedback, PEMF, supplements, dietary changes, really specific types of behavioral therapy, psychotherapy. You can't just do general stuff, much further than with psych meds. And I could go on and on in the complexity of cases. Right, understanding what the real problem is and then addressing it appropriately is dramatic in the difference, right? That's why a lot of people choose to work with me one-on-one, which we only work with 5 or 6 people in a month, and it won't go on forever, people. So what are some of these non-medication approaches we've been talking about? So one, that diet and nutrition. You can't shortchange that. I have total respect. You might have a restrictive kid. You might feel like that's the biggest hurdle. Just pick one thing, right? Removing something, adding something, that could be helpful, and just chip away. That's what most of my people do. Usually they come to me, they regulate, and then we do some pretty accelerated changes. You can't do that until the nervous system's regulated. Don't try to take away the chicken nuggets. I laugh, but I know it's hard. Certainly, we talked a lot about neurofeedback. It's a treatment that is there designed to quickly and effectively and safely regulate specific areas of the brain, but also the brain communication centers so that you're impacting neurotransmitters, brain waves, and you're pulling that nervous system into a parasympathetic state. Just lots of love for neurofeedback, very dependent on the provider and their skill set. And again, make sure you're going to somebody who's licensed and board certified or in the process of getting board certified, because then they are required to have a lot of clinical supervision. It is, the Wild West out there, and you want to be careful. They have people operating, doing neurofeedback who don't have a license. I mean, you at least have to have a license. Most states that require it. So PEMF, right? Love PEMF. Please go back and listen to the episodes. It's using low frequency magnetics to change the cells, improve the autonomic nervous system by pulling it down into that parasympathetic state. And then it is reducing inflammation by improving detoxification, all critical in helping that nervous system regulate and then allowing the brain and body to do what it's supposed to do. And then certainly mindfulness and relaxation techniques, you can't underestimate the value of that. If you start your day, you end your day, maybe in the middle of the day. I do these things all day long. I pray, I do breath work, I do 4-7-8 breath. I don't know how many times in a day. I mean, maybe 10, 15, 20 times. Always working to keep my system lubricated, dealing with stress. Your body doesn't know the difference between good and bad stress. And I have a mix at this point in my life, right? Having kids that you still have to cart around, and then a parent who just had an injury. These are the things that we all face, and stress builds up within the system, right? By practicing mindfulness techniques, relaxation techniques, you can do this on your own. You can do this with your kids. You can have your kids do it, but it amplifies when you all do it together and you move to a peaceful state. Very, very helpful. And then you can't diminish the power of psychotherapy. Behavioral therapy, parent therapy, individual therapy. I find parents need parenting support more than any other thing. And honestly, it's the biggest bang for your buck. If you're taking your child to a therapist who is not working with you, I potentially would run, but I also would say to them, is there a reason why you're not seeing me? Because I need help. Because if 1 hour a week 45 minutes with your kid is not going to create huge change. But at 45 minutes with you and you doing daily work is the quickest path to change, right? Hopefully you're like, what? And again, you're not a bad parent. We're just not equipped. We don't know how to manage it. And a good therapist who's working with you as a parent is actually problem solving with you and coaching. She just won't go to this ballet class that I paid for. I tried this, I did this. What do I do? I'm not saying that's what she should do, but at least you can problem solve and you can get some support and not feel like you're terrible. You don't have to spin on it. It's a good thing. Okay. So can non-medication approaches be combined with medication? The answer is yes. So, each one is different. You want to always have your providers work together. If you have a prescriber, they hate some of these approaches. Thankfully, it's improving. Honestly, even most prescribers, they want you off medications. Not only that, they really want you to be better, right? So if you have somebody who's really rough, like there was a local provider, he is a nut job psychiatrist. He actually left messages on my answering machine back in the day, just was vehemently opposed to neurofeedback. And he told this mother I worked with, who was a lawyer, if you go there, I'm going to exit you from working with me. And she's like, what do you mean? We're not coming off. We're not doing anything about the meds, and we're seeing your therapist. And she's like, that's unethical. If you do that, I'm going to file a complaint against you. And he didn't know who she was messing with. That I sadly isn't always the, time. That's not the only time I've ever heard something like that. You need to collaborate with trained professionals, right? Do not ask about integrative, non-medication approaches, whatever, from somebody who's not trained in it. If you're asking about that, what do they know? They can't give you information. I just don't understand sometimes where parents are like, well, I'm going to ask my pediatrician. Now, I talked about American Academy of Pediatrics rates neurofeedback a level 1 intervention, same as medication for ADHD, but hardly any of them tell their patients about it, right? That's surprising. That's shocking. I've educated a lot of pediatricians. I didn't even know that occurred. It was on a pretty clear document summarizing all this research that came out in 2012. So don't ask for advice, right? Now, I am trained in traditional and integrative. I don't believe in one path. I believe in nervous system regulation, and there are many paths. I'm just sharing with you what I know, having worked with thousands of people, to help get quick results and long-term change, right? So you can get quick nervous system regulation. It's not going to stick unless you're doing it on the regular. And that takes time. And I hope that, helps people. So you always want to weigh your options, right? Think about pros and cons, and then make a plan and do it and stick with it. Don't abandon it after a week. Some of these things you're really going to have to be in there 2, 3, 4 months. And that's okay as long as you're moving in even the slightest micro step, right? You got to start with brain regulation and be patient and look for those changes in intensity, frequency, and duration of symptoms. You're probably not going to have just an overnight kind of change. I remember, years ago, I had somebody with sensory processing issues. It really was a sensory processing disorder. They had tried all different things. They had tried OT and it helped. And then they tried this and it helped. She'd never been able to be responsive to therapy. And then she tried to go to college and she really fell apart. She just needed a lot of guidance and she couldn't get that kind of wraparound support at college. So she really had a full-on breakdown and was very depressed, was actually inpatient. Nothing was helping her. What did we do? We really worked on regulating her nervous system. We supported diet, and slowly she crawled out of it. And the outcome for her was that she needed ways to modulate the sensory information. That was actually what was the base of her chronic depression. And then she needed strategies on how to manage and regulate the discomfort. So we could dial down the discomfort, but when it happened, she couldn't go into this depressive state. And that's what we did. And, years later, just want you to know this was many, many years ago, at least 10 years ago. And, went to college, graduated, actually had something really horrible happen to her at college and got through it. It was just like amazing. And that was because she had a regulated nervous system and she learned ways to cope with uncomfortableness. So I hope this whole series has gotten you really thinking very differently about the science, the root causes, and the treatments, and understanding what is helpful and hopefully brings you hope. And know that if your kid hasn't gotten better, doesn't mean that they can't get better. And the missing ingredient is nervous system regulation. And there are many ways. So if you are looking for help on how to regulate your child's nervous system, your own, because a lot of times parents are now they're really telling me, like, Roseann, you're talking about me too. You can go to drroseann.com/help. That solution matcher is going to guide you to where you need to be, and you'll get great information. And make sure to whitelist our email so that you can always get our offers. And we share lots of free information, just like in this show and what we do. So just put one step in front of the other and really, really trust your gut in making the right decision for your child and family.